Hello and welcome. My name is Meredith Rowe and I am presenting to you an overview of electronic healthcare records and the Health Information Exchange and how you as a consumer and patient will be affected by the implementation of EHRs in your doctor's office and hospital. Studies show that patients who are more actively involved in their healthcare experience have better health outcomes and incur lower cost overall. As a result, many public and private healthcare organizations are implementing strategies to better engage patients in their healthcare. Patient engagement is particularly crucial in the success of the Health Information Exchange. The Health Information Exchange works by combining comprehensive and complex technology. As consolidated clinical information becomes available through the HIEs, patients will need to be educated in the use of that information to effectively take responsibility and accountability for their own health. Some overall goals of adopting an electronic health record are the improvement in the quality of health care of the patient, there's a significant decrease in the health care cost, and there's an increase in the patient involvement within his or her own health care. Some of the components of electronic health records would be clinical documentation. This section would probably include your patient demographics, the primary and consultative physician notes, any nursing notes, comprehensive problem list, medication list, discharge summaries for your patient, and advance directives. Also, you're going to see a test and imaging results. This would include your radiology images that the patient has had done, any lab results, and also any other diagnostic studies. Continuing on, the components of the electronic health record system is going to be where we're going to see computerized provider order entry available. This is where your physician is going to be able to go in and put in different nursing orders, different lab tests that need to be done while you're in the office or while you're waiting. Also, radiology and diagnostic tests would be located here, and any consults that may be needed along through your care. You're also going to find decision support. This is where clinical guidelines and prompts may be located. Also, pertinent drug dosages may be made available easier. And any allergy and medication interaction alerts would be located under decision support as well. There are many benefits to having an electronic health record system, and a few of these, the first is going to be comprehensiveness. The use of electronic health records offers a more comprehensive picture of the patient's health to the physician. The physician has easier access to patient health records that aid in faster information collection in order to better evaluate the patient's current condition in the context of his or her health history and any other treatments already in progress. A comprehensive EHR reduces the risk of repeating unnecessary tests or procedures, which leads to safer health care. The next benefit I'd like to mention is speed. Access time to EHR is much faster and can be very beneficial in any crisis situation. Instant access to pertinent patient medical history, allergies, and current prescriptions aids in faster treatment and less wait time for the patient. The next two benefits I'd like to mention is alert and prevention. The electronic health record systems have embedded notifications that flag providers for potential conflicts such as medication interactions. The EHR's technology is beneficial in prompting the providers of any issue before something harmful is given to the patient. Within the EHR is a flagging method when the provider uses the e-prescribing system that incorporates a verification system to check the barcode on a medication against the drug name and dosage information on the original prescription, further helping pharmacists avoid dispensing the wrong medication. Some other patient benefits that you need to know about are the expedited prescriptions. Going back to the e-prescribing systems, this allows for the script to be ready at the pharmacy upon arrival, aiding in less wait time for the patient. There's also less risk for medication errors. The next benefit would be quick information sharing. The EHRs allow patient information to be readily available to all providers involved. Examples would be lab results and radiology reports that would be seen by your primary care doctor and any other consultative physicians in your care. Patient portals give the patient access to the most current health information, allowing for active involvement in his or her care. Next would be a reduction in paperwork. The electronic health records and the HIE allow for concise data to be stored and updated regularly. The sharing of information through the HIE will reduce the amount of paperwork patients have to fill out repeatedly regarding their health care and their health history. There's also a reduction in unnecessary testing. All tests recorded in the EHR and the HIE are made available to each provider and can be viewed easily, resulting in less likelihood that duplicate testing will be performed unnecessarily. This saves time, money, and patient discomfort while reducing the risk. There's also been an improved follow-up and follow-through noted with patients. The EHRs use reminder systems that aid in reminding patients the email or text of appointments and staying current on their plan of care. Also, reminders are available to the provider to follow up with the patient about ongoing health conditions or to offer new medical treatment methods. There's also a secure data access. In the event of a crisis or disaster, the EHRs will make it easier to obtain patient data and rebuild patient records in the HIE. EHRs allow patient information to be available even if the patient is away from home due to relocating for a crisis or disaster. So what is a patient to expect with the new changes in the doctor's office and hospitals? You can expect new ways to register and make appointments by using electronic tools such as patient portals and personal health records prior to the patient's appointment. Appointment reminders and follow-up reminders sent via email and text alerts. Doctors using smartphones, tablets, iPads, and computers to access the EHRs at the bedside. And e-scribing, where prescriptions will be sent to the pharmacy waiting on patient to pick up, discontinuing the use of paper scripts. And the ability to access all patient lab and test results via patient portal using a secure PIN access code. Some things to evaluate while we're teaching you is any evaluation of any language barriers, education and literacy levels. Want to be aware of any visual or hearing impairments. Be able to assess for signs of dementia or other learning disorders with the patient. The nurse needs to use clear and concise vocabulary, allow for time of questioning, give each patient an opportunity to interact with the EHRs, provide reassurance to patients who have difficulty navigating or learning, and always give positive feedback. As far as reassurance and follow-up, as a nurse and healthcare provider, we want to make sure that we provide brochures and handouts with step-by-step instructions on how to access patient portals and a phone number for troubleshooting. Reinforcement of new electronic systems should be provided to the patient during registration phone calls and appointment reminders. Provide informative videos for patients about accessing patient information during lobby waiting times. One study suggests that an offer to provide assistance in creating and setting up the patient health records and patient portals while the patient is waiting to see the doctor is beneficial for patient compliance. They also suggest that you may have a clerical staff to aid the patient in navigating the system and teaching patients how to view, download, and transmit health information. It's also another suggestion to maybe have kiosks available in the office lobby for patients to access personal health records. This would be especially important for patients that don't have access to a computer at home. This would be an easier opportunity for them to be able to learn and navigate on an EHR in the office. As healthcare continues to be increasingly patient-driven, patients, as the ultimate consumers of their own healthcare, will be called upon to ensure exceptional health care for themselves and their families. Whether one looks at patient portals, mobile apps, or social engagement platforms, it is obvious that health IT systems focused on patient engagement are growing by leaps and bounds. This concludes today's discussion on the benefits of electronic health record systems and HIEs and how you, the patient, will benefit tremendously. Thank you. Have a nice day.